everyone. My name is Natasha and welcome to Izulami.
And my name is Kumo. Thank you for joining us once again. Today's conversation, we're going to be talking about the realities of COVID-19 and, just what would happen if you were to contract the virus. And we have a special guest today. We are with Dr. Oscar Mabele, aka Dr. O. I really love that. And he's a senior family medicine registrar at Botshabelo District Hospital. And he also has a passion for informative media, working as a liaison between community and hospitals via media and radio platforms, providing updated information on COVID-19. Thank you, Dr. Oscar, for joining us today. So I think if we step right into it, I think the most interesting question, because there's been a lot of conversation happening on social media and on Twitter about the state of our health system. So from a realistic perspective, because you work in what does it look like? Should we be as worried as the Twitter streets say we should be? Do we not have hospital beds? What's the reality?
Okay. First of all, thank you so much for having me. It's a wonderful platform that you guys are doing. So from my perspective, which is one perspective out of many doctors' perspective, depending on where I'm working. So I work in a district level hospital, which is like a primary healthcare facility in Botshabelo, which is a town close to Bloemfontein, right? So first of all, the structure and how we operate has changed dramatically, if I can say that. So we used to have a system on what happens when a patient enters our premises, from casualty, then to admissions, and then to OPD or the wards, whatever it is. So that system has changed because we're trying to keep people safe and also trying to keep the staff safe. So there's a strict protocol with regarding to people screening and also adhering to the precautionary measures that the government has told us about. You do understand? So that system has changed. And with regards to, there's been an increase in the rate now of people contracting the virus and then developing COVID-19, and then people responding differently to that. And so now we are seeing a lot of people who are old, about the age of 60, who have comorbidities, who are presenting to our hospital facilities. And we see ourselves now having to manage a lot of patients who are, who are complicating on the COVID-19 because they have comorbidities. Comorbidities is things that you can have that can put you at higher risk of having a severe COVID-19 infections. Do you understand? In our community, we have a disease profile where we have a lot of old people who have uncontrolled diabetes mellitus, uncontrolled renal failure, uncontrolled hypertension, uncontrolled HIV, or who have malignancies or cancers. And when those people contract the virus and develop the COVID-19 disease, they're more prone to have a much more severe disease compared to the average normal young person. So we're seeing a lot of those people, and right now we are literally struggling with the increase in bed occupancy rate. So more people are being sick, and then more people need to be treated. But the issue is that in our normal setup in hospital, we have had to now increase the distance between beds. So one cubicle, which could fit like 8 beds, can now only fit like 6 beds because we're trying to maintain the distance. So even though the structure is still the same, but then the number of beds you can fit in one cubicle is less. So that's why we're having an issue with the bed occupancy rate. And of course, our hospital has adapted to that. We have literally transformed other departments into beds, if I can say that. So which means our allied people, for example, your physiotherapist, your occupational therapist and stuff like that, we have literally transformed their facility into a bed place for people with COVID complications or those who are under PUI, which means patient under investigation for COVID-19. So we literally have to move them from one place to another, a smaller place where we can use their space and turn it into a field hospital or into a makeshift hospital so that we can try and keep up with the demand for hospitalization of people with COVID-19 or under PUI, if I can say that. So that's what it looks like in my facility. And I guess people will have different opinions about their own facility, but then so far where I'm working, that's what it looks like. It's very overwhelming. More people are coming and we have to now deal with them, if I can say that.
Yeah.
So Dr. O, you mentioned that, obviously when people come in, you have to screen them to actually make sure that what they are presenting, is likening to what would be COVID-19. And just you just mentioned that you're starting to see an overwhelming number of patients coming through that are presenting with like the critical side of COVID-19, right? So I want to focus and I want to ask two questions, but I first want to focus on the people that are presenting as critical and need to actually be hospitalized. And so with the people that are now starting to increase and the overflow, I mean, we're reading the stats, etc. What are actually the plans, I guess, in your case and for the hospital that you are in? So what are the plans when you no longer can expand into the other departments? What are the field hospital type of contingencies that have been put in place for your district?
Okay, so from where I am working, because we starting to see that there's an increased number of people who actually need to be in bed, who need, there's a specific treatment that is part of the protocol for people who are complicating. So we have a strict admission criteria. So if you are old, like about 55, and you have comorbidities which are uncontrolled, and you have those signs and symptoms which can lead to, which suggest COVID-19, and if somehow you are having difficulty in breathing, or your heart rate is high, you have heart, your heart is beating faster, or if what you call saturation, which means how your body receives oxygen, if that thing is low, then you warrant for admission, because those people are the ones who can complicate and they might end up dying. So that's our admission criteria. It's a very strict one. And so with those people, we used to have what we call male and female adult wards, if I can say that. But that no longer exists. Now we have a mixture of people, but now the distinguishing parameter is that either you are a non-COVID patient or a COVID patient. Either you are diagnosed COVID positive or you are patient under investigation, which means we tested you up because you screened positive and now we're waiting for the results to come out. So that's how we have separated the wards. So things have changed at how we deal with the wards. So people in PU are very strict protocol. You must have PPE all the time, social distancing. We try to have one nurse with one cubicle, one doctor with one cubicle, but it's hard because we need more people to understand. It's hard to have enough people. And then we have somehow transformed our pediatric unit. We used to have a big pediatric department where we have kids to the age of 12. We have dismantled that and turned that into you are COVID positive, which means you have COVID, but you still have issues, to understand. So we've turned that into COVID positive ward, if I can say that. And then we have moved pediatrics into what used to be the allied department where we had physiotherapists, social workers, OTs and stuff like that. So that now is our what we call the pediatric section of the ward. And then those allied people are now helping us with the screening process, with the stats, going to the community to go test people and stuff like that. So those people have shifted their job description into COVID-19 frontliners, if I can say that. And no more tooth extractions, no more, physio session. Of course, for emergency cases, they do. For other stuff, they're very flexible, but then they're now doing the frontline work, going to the community and doing part of the task force team of COVID-19. And then in the Free State in totality, of course, they have makeshift beds available where we have in case of emergency, which means in case we now need to transfer people from the hospital to those sections, there is a place allocated for that, and then there are beds available. But then you want to now understand, there's a difference between having a structure and mechanical resources now to deal with patients. But you don't only need that for this. You also need human resources. You need nurses. You need doctors. You need people who are going to clean up to your work. So we have that, but then the crisis will be if we don't have enough people or human resources to deal with those field hospitals. Do you understand? Then we'll have to adjust and see now what will happen. Do we I'm not the management, so I don't know what their plan would be, but we do have I would say the structure is there, the equipment is there, but we need doctors, we need nurses, we need other people, cleaners, we need people to be part of that structure to make sure that everything operates well.
So
Awesome.
I would like to bring it back to maybe an individual perspective. So
Yeah.
I think my biggest question, and what creates more anxiety, is what happens to a person's body when you do contract COVID?
Yeah. So let's get the terms right? So we have coronaviruses. That's the big umbrella term, coronaviruses. Ne? It's like a family of viruses, but they belong to the coronaviruses. So the corona means that the virus under the microscope has those spikes which looks like a crown. So that's why it's called corona. So the corona word means like a crown, something. So there's many of those viruses. Ne? And the strain we're dealing with now is called SARS-CoV-2, right? SARS-CoV-2, that's the one that is causing COVID-19. So COVID-19 is the disease manifestation of that virus. You understand?
Okay.
So when you're testing for that virus, SARS-CoV-2, and when it enters your body and causes disease, it's called COVID-19. Do you understand? So that's how we use the terms. So now we have, I think, 9 billion people on Earth, or we have 60 million people in South Africa, right? All of them with unique bodies, unique immune systems, or all of them have what we call a problem list. They have different comorbidities within them. Some people have diseases like your HIV, diabetes, renal failure, cancers, hypertension, stuff like that, different ages and stuff like that. So each and every one of those people will respond differently to the virus entering their body. Do you understand? So according to the research so far, we know that if you are young and if you are healthy without any conditions, when the virus enters your body, you will have what we call your mild to moderate like flu-like common cold symptoms. So people will respond with a severe headache, like it's a very severe headache. You might have a cough, like a mild cough. You might have a sore throat. You might have like joint pains, or you might have like a fever. You might have like loss of appetite. Some people can also have like some form of diarrhea, or they can have loss of smell and taste to food. Do you understand? So those are what we call like your mild to moderate symptoms that you might have. So we have this thing called incubation period, where we say from the time the virus enters your body to the time that you have the symptoms, it takes about 2 to 14 days. So for some people, it might take 2 days for you to have the symptoms. Some people, it might take 4 or 5 days, but the maximum on average, like 14 days. You don't understand. And when you still have the symptoms, you still are infectious, which means you're still able to pass the virus from you to other people. Hence, we have that thing of when you are confirmed COVID-19, you self-isolate at home for at least minimum of 10 to 14 days so that your body can recover, so that you don't have to become infectious to other people. But that applies to those people who have your mild to moderate symptoms. You understand? However, there are some people who have high risk factors that can make them to have a less severe disease to the COVID-19, because somehow the virus enters your body and through your bloodstream, and mostly it will go to your lungs and then just all over the body. But then when it's affecting your lungs, that's when people start to have difficulty in breathing. You struggle to breathe because it affects what we call how the air enters your body and the exchange of the gases, which is why the oxygen cannot reach your lungs properly, and you cannot transport oxygen to the other parts of the body, and you need oxygen for your other parts of the body to function well. So people like that will have like a severe inflammation on your lungs, and you have struggle to breathe. So those people are what we call those who have a severe reaction to the virus, which means those people who might require to be in hospital. But we have a very strict criteria as who gets to be in hospital. Like I said, if you're above 55, you have comorbidities, and we check your saturation, it's low, then you really need to be admitted. But you do get young people who also reach that stage of having difficulty to breathe. So if your saturation is quite low and you have a increased heart rate and you look acutely ill, then you do qualify to become hospitalized. Do you understand? We've been told by the specialists, the virologists, that most of the time, these people need a lot of oxygen. They need to be with those masks and the nasal prong, whatever it is, but they need a lot of oxygen. Do you understand? And then so far what we treat these people with is that the oxygen must be prescribed quite well. So on your script as a doctor must really prescribe specifically how much they must get and how long and how often, stuff like that. And also we try to provide some antibiotics, if you have a secondary bacterial infection to that, and we like supportive treatment for you as an individual. That's the protocol that we're using right now in a state sector where I'm working. I think people got different protocols where they're working. And then so when you do get admitted, it's a very strict management. The nurse and the doctor must work hand in hand to try and improve and optimize your treatment as a person. So people respond differently to the virus. Most people will have your mild, moderate symptoms. Even some people won't even have any symptoms. Those are what we call the dangerous ones, because they have the infection, they have the virus in them, but they have no symptoms. So they think they're fine, right? Yeah. They think they're fine. So you can imagine a person who has the virus but is asymptomatic and does not adhere to precautions. So they're busy talking without the mask, touching, whatever. And because they have no symptoms, they think they're fine, but then they're the ones spreading this virus to people. And it's hard to control human behavior. So you have those categories of asymptomatic, mild symptoms, and severe disease and critical. And then the difference is just the numbers of those people. Do you understand? Yeah.
So Dr. O, now that I have corona, or I suspect that I might have corona, and I'm self-isolating for the required period, what are some of the home remedies, that I can potentially take to just make sure that I'm taking care of myself during this period? Because I think we've been hearing so many home remedies, and I think, coming also from like African homes, they speak about traditional remedies. How effective are those? Are those even recommended? So how do I treat myself during this period?
Okay. So like I mentioned, for most people, they will have what we call your mild, moderate signs and symptoms. They're like flu-like signs and symptoms, the ones I mentioned. So during those times, your immune system must be boosted to try and fight the virus that is in your system. Get to understand? So the way you try and help your immune system to try and boost, to try and fight off this virus, you can do the following. Like, for example, that I was diagnosed in 24th of June. So I had the mild moderate symptoms. Do you understand? So I had severe headache. That headache is bad. Most people will tell you that the headache of COVID-19 is quite bad. So it was very severe headache, and also had some joint pains. So for any form of pain, I would use like strong pain medication. So I had Panadol and Brufen and Miprodol. Do you understand? And at night I was using like Tramadol. So those are pain medication that you can get over the counter for deal with the pain that comes with the COVID-19. Do you understand? And then for the sore throat, I was gargling with warm salt water and cayenne pepper like twice a day. Do you understand? I would do that in the morning and then also in the evening to try and just to ease the throat up. But it was a sore throat and it also affected my voice. And also sometimes I would use strepsils to try and tease with the sore throat. It's like if we have flu, like that type of pain. Do you understand? Yeah. And then for the fever, and which I had is a fever that you have. Panadol can also help with the fever. And sometimes I used to drink one of the traditional remedies that we use, like Gilengana, that bitter thing, the green thing. Yeah. You can buy it, I bought it downtown, taxi rank, Gilengana, where people, I think you cook it with water and then you drink the fluid. But I want to emphasize something. Lengana does not cure or eliminate the virus. I think it's one of the remedies to try and alleviate the symptoms that you might have as a person. Do you understand? It does not. It helps you to alleviate it. And we used to do this when we have influenza, the flu, when you have your headache and your fever because of flu, some people would drink lengana to alleviate the symptom that you have. So after you're drinking it, you feel quite good because it helps with the fever and inflammation, stuff like that. So it does not cure or eliminate the virus, but it helps to alleviate the symptoms that you might have as an individual.
Yeah.
And then the other thing was that to boost my immune system, I would drink supplements and vitamins, which is something that you must do before you get infected, but you know, human beings. So
yeah.
Vitamin C, mainstay. Vitamin C, we know that vitamin C very important. The ascorbic acid in there, it helps to boost the immune system. It helps to fight off the virus. So I drank because it comes in different forms. I drank the tablets, vitamin C, but also you can get vitamin C from your orange juices, like your citrus fruits, your lemons and stuff like that. So I did that. I also had zinc. I also had vitamin D as well as a part of my supplements. And then I drank a lot of, that lemon, honey, ginger infused mixture, if I can say that.
Yeah.
It's like the shake.
No, a homemade one, which means you cut real lemons, ginger, and garlic, and you make many cups of those. So which means I drank many cups of those every day. I don't know how many cups I drank. I would drink those just to boost my immune system to help fight off the virus. I also, very important, a well-balanced diet. A well-balanced diet, 3 meals a day. And I understand for most people, it's difficult because in the beginning of the disease, you don't have taste or smell, or you don't have appetite for food. So it's kind of hard to eat anything. So you must adapt. So I remember I enjoyed a fruit salad often. I enjoyed like soft porridge. Sometimes they mix it with peanut butter to give me the energy that I needed. And then, but I would try and force myself to eat a well-balanced diet. It was very difficult, but then I tried to eat a well-balanced diet. And in between, I ate healthy snacks in between. You have your nuts, you have your dry fruits, you have your vitamin shakes and stuff like that. And also to keep yourself hydrated. So lots of clean, good quality water is important. Your rooibos teas as well. I also drank your Powerades and energy and stuff like that, just to hydrate myself as often as possible. And then the other important part, which I think people forget about, your mental health is also needs treatment during that time. So resting means that you rest your body and your mind. So you can't be resting on that bed, but still thinking about what you should be doing, your schedules, your meetings, your blah, 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 blah. That's not resting your body. Your body includes your mind as well. So yes, I was on my bed, but I had to now switch off, which means all my radio slots had to now stop, because I work with 3 radio stations. I had to stop that. My normal routine had to stop. My studies had to now change. I had to stop with my postgrad program as I know it. I had to stop stressing and worrying about what I needed to do. To understand? I think it's hard for people who have kids. I mean, you have a child, who's going to wash my child? Who's going to clothe him? Who's going to do that? So you have to adapt all those things. You need to ask for help. That's very important. You need to ask for help, or somebody must take the child in the meantime. Somebody must help you with something, somehow. What this is. And what helped me is that I had colleagues who knew what to do. So which means they send me, for example, there's an app that you can use for someone to help you buy groceries, for example. The company comes to your house, you give them the list, and then they go buy it and you pay them EFT, for example. There are those companies which help people to do that. Family members can come also to drop off some groceries, and you EFT them their money for the groceries. You can WhatsApp people to go buy you some prescription, and drop them at the gate or the door, and you can fetch from the door. You understand? So people must adapt those things as they know it. So you need help. Your friends, family members must come and help you with your normal routine. You've got children, if they can move to a different place, please do that. If they can be taken care of by somebody else, please adapt yourself. Ask for help. You need help. And then for my mind and soul, I used to watch a lot of comedy videos, like your Chris Rock, your Chris Tucker, your David Chappelle. I would watch my day. That's how I just dealt with the stress and anxiety that came with that. I stopped watching the news because the news, they have these sensational headlines. I remember I had it that time when the graves were being unveiled. Who to 1 million graves, something.
Woo!
So,
we're all panicking after that.
yeah, such headlines can make you panic, can cause anxiety. During that time when we saw young people, my goodness, every day, young people were dying like that. And we see the videos on social media where people have oxygen and stuff. Those, if you can stop that for that time, just to ease off anxiety and to eliminate any form of stress or panic, please do that. And also listen to gospel music and some sermons sometimes. So just to address the heart and the soul during that time. That's very crucial and very important to do. And well balance, like you have to have a balance between your mind, your body, and your soul. That's what it means to be a healthy person. A state of balance between your mind, your body, and your soul.
That is very true. And I think, that's one aspect that people negate, to focus on. And I think it's also a product of the environment that, I work in corporate and I have Corona now, but, I feel like I'm still expected to deliver, right? Because I don't want, should reviews be coming, I don't want to be the one that'll be like, but she was out for 2 weeks, So that puts me on the back foot. But it's very important to take care of your mental state during that time.
It's
so
very important.
No, 100%. So Dr. O, we know that we don't have a vaccine that's going to come into market anytime soon. And, this could be life as we know it for a very long time. Yeah. So just moving into the future now, what does the future look like, from your opinion, in terms of us actually living with Corona until we actually get proper vaccines, treatments that will actually help? How do we continue to live as people without having to live in fear?
Okay. So you are right. It looks like, by the look of things, it might look like the COVID-19 pandemic might be with us for quite some time, to understand. But what I'm most grateful about the experience, even though it's not a pleasant experience, is that it has hopefully somehow awakened a lot of people with regards to taking care of yourself before something happens. Do you understand? Mm-hmm. So I think people now appreciate the idea of a healthy diet, or the idea of taking precautionary measures before something wrong happens to you. So I think somehow, because we speak about it every day, it's on the news, radio, whatever it is, billboards, whatever it is, so people now appreciate or embrace precautionary measures, preventative measures, which is what is important to try and prevent the disease. Like simple thing as washing your hands frequently. Don't wait for a pandemic to practice washing hands frequently, because that's a normal thing to do. Do you understand? Yeah. Washing your hands before eating, washing your food before eating it, after using your bathroom, washing your hands. Those are basic things that somehow I think COVID-19 has somehow emphasized to our brain. Say, what, guys, we need to practice these things before something wrong happens. Eating healthy, exercising, and also becoming aware of your underlying conditions. I think for most people, especially in the Black communities, that most people, they have the condition, but they're not up to date with it. One of the things that makes me angry every time I consult a person is that somebody could be having HIV for many years, but they don't know the basics, or they don't know how it affects their bodies, and why they must take the ARVs, and what a CD4 count means or viral load means. So it frustrates me when, especially if it's a young person who doesn't understand just the basic things about their medical condition, because it means you don't have insight. It means you cannot work with me, because even if I prescribe medicine to you, you won't understand what I'm doing and why I'm doing it. So hopefully, I think this pandemic has taught people to become aware and to take control of their medical condition. Do you understand? And the other thing is that I think this pandemic has also exposed a lot of maladministration and poor systems and processes within our healthcare system, whether that's at the hospital level or at the policy level or government level, that it has exposed all those systems that don't really work don't function quite well. And so hopefully if we have future managers or CEOs or CMOs who are who are in this pandemic, they will change their way of doing things. And you know, simple thing as we have people who don't have access to basic water and sanitation. That's a problem. That is a huge problem. You cannot try to control a contagious virus like SARS-CoV-2 if someone doesn't even have basic water to cook or drink. Do you understand? Yeah. So hopefully that has somehow assisted with the speeding up of service delivery to those communities. Do you understand? When it comes to the vaccine and stuff like that, I know, and cure, I know people, they are obsessed with things like that, like a cure or a vaccine and stuff like that. But I think such things undermine the capacity of human behavior to behave right and to do the right things. Do you understand? So I think we are so reliant on cures and vaccines because we don't believe in our own capacity to do the right thing. I mean, we can control this by simple things like washing your hands frequently, social distancing, wearing your mask, sanitizing your surfaces that people use all the time. That can be done by a human being. That's possible. A vaccine is important. Yes, it is important. I advocate for it, but those things take time. A good, effective vaccine takes time to develop because you must test people, make sure that it's safe. And when you do have the proper vaccine, the other challenge is that how do you make it accessible and available and affordable to the masses? Do you understand? Yeah. So even when the vaccine do come one day, the issue will be like, okay, government will have it, for example, but then how do you make sure that 56 million people have access to it and is affordable and is sustainable to a lot of people? Do you have money for that? Do you have a protocol or systems for that? Do you understand? So it's going to be another challenge to go through. Do you understand? So hopefully the vaccine will come one day, but then it's going to be another hurdle to make sure that it's available to everyone who is at risk.
Yeah, for sure.
So I think maybe, I mean, my final question, and Natasha will elaborate better on it, is I think every sector is susceptible to some form of disruption, right? And the pandemic has showed us in the way in which it has shifted almost every industry right now. And so now, I mean, for example, last week I had to book a doctor's appointment because I was a bit paranoid that I might have, the virus through a virtual consultation, right? So my question is, what does the future of medicine and medical care look like? And if there is kind of like a future, are we ready for it as South Africa because of the climate and the demographics of our country are really not as modernized and as progressive as other countries, and especially because of our public health system and the people who depend on public health system. So what does that look like? If there has been some form of disruption in the industry?
Yeah, that's a very good question. That's a very good question because, like you said, the Covid-19 pandemic really has shown the potential of what technology can do. And we've seen it in different sectors of the economy or just in South Africa where people have now had to change the way they operate their businesses or how they function in the world with the usage of technology. Like you said, example of trying to consult a patient through a virtual connection. We all know that way of consulting depends on what the condition of the patient complains about. For example, I can't consult you via video if you're having an asthmatic attack. It would make sense because you'll be there, hyperventilating, and I'm here. So there are some medical conditions which I think can be tried and can be explored by using, telemedicine. I think one department that works very well is your psychiatry and your psychology department, where I think you can consult your psychiatrist and your psychologist via video, and then depending on how severe your disease, mental illness is, I think that can also work out where you can, either call them or you can consult via like a video. And then also the other thing is in medical school, for example, where now there are some classes which we received via, Zoom calls or via other platforms, which allowed you to be wherever you are, but then somehow still able to get access to information that you needed. But then somehow, in medicine, it's a balance between theory and practical work. So you still need to practice and to have your hands on some practical aspect of medicine. So, but with regards to the virtual stuff, I think that can help to try and you can deliver information anywhere in the world through such platforms like Zoom and stuff like that. Even in corporate, I know that we had people that can work from home and still send emails, depending on what your job description is, send emails and do whatever while you're sitting at home. So, and people, I think, in my opinion, people become more effective when you are at home in your own comfortable place. Do you understand? I think there's been people who say, you know what, I'd rather do that report at home, because at work, there's too much happening. There's people, there's competition, there is, there's many obstacles that can impair your effectiveness of working. And I think some people like it to work better from home, so they can also work for that. So I think there's an opportunity there to use technology to improve the way we practice medicine. And but the issue is that, like I said, it's about accessibility, affordability, and how far can you stretch that. So yes, you are able to consult your doctor because you have a smartphone, you have data bundles, you have Wi-Fi or fiber, but you are one out of 56 million people. And then when you look at the bigger picture, how many people have got smartphones and iPads and laptops or whatever and have fiber and data to have the same privilege of consult? Or not only that, how many people have got their own doctors to call? You understand? So it's that other issues that, yes, those ideas are possible, but then in a very unequal country like SA, only a few people would benefit from such a structure. So you need a government or a state approach that will be able to make sure that everybody has got access to those things, resources that can help them to also have the same privilege as you did. And that's very difficult in this country. For example, if I can make an example of the idea of PPEs, which I think has become a scandal in the country recently. Simple thing as, let's give you money, you distribute PPEs to these people. That has caused drama and scandals. So you can imagine if we now have to make available cell phones and iPads and data to many people, how much that will cost. It takes people who are true leaders, who are honest leaders, who have Ubuntu, or who practice from an ethical point of view to be able to deliver such resources effectively to the masses. And I don't know if we have enough people who have that in our country. We do have them. I don't know if they have. We have enough people in different departments who have the ethos of that. And I can make a bold opinion and say, you know what, I think women are at the forefront, are more capable of having the ethos to carry out such tasks, if I can say that, because I think Basadi or women are more ethical and more inclined to do the right thing compared to males. I don't know if that makes sense. So if we can have more women who are influenced by other women, not women who are influenced by men, because it will not make any difference to understand. But we can have women who can make better decisions to try and make sure that we have effective leadership in different sectors and departments, then I think we might go to the right direction. That's just my opinion, one in 56 million people.
100%. Such a riveting conversation, Dr. O, and thank you so much for your insights. And, being someone who's actually lived with the virus, I think, your opinions definitely hold much more credibility for the people that are listening, and surely to ourselves. So, you mentioned just like a lot of things for us, to take into consideration. But just as we wrap up this conversation is to say, COVID is definitely here to stay. And the only way that we can manage in this environment is by managing ourselves, right?
Yeah.
So we have to definitely adhere to the guidelines by doing the basic things like washing our hands, washing our foods before we consume them, wearing a mask, right? That is so basic and so important, and trying to observe social distancing. The system is definitely under a lot of pressure, and the more that we can do to stay away and out of that system, the better the country is holistically. You also mentioned something, that is very important to say, that it's important for us to know our bodies, right? To know the kind of conditions that we have now and not wait for a pandemic to be in the picture for us to start worrying whether or not I have an underlying health issue, right? Because I think that's one of the things that I've been sitting here with, also saying, do I have an issue that I should be worried about? Should I contract COVID today? And then just the last point that we were speaking about, technology, to say, we definitely know that technology is going to enable a lot of functions, in society and bring about changes. And I think, telemedicine is definitely something that is quite interesting for us to observe. Like Kumo said, that understanding that the South African landscape and demographics that we have make it that much more interesting for us to innovate around, to see how we can actually provide primary care to people that have different accesses to technology. So I mean, wholesome conversation. And thank you so much for coming and joining us during this segment. And just to our viewers, if you guys just have any questions around COVID, or any of your experiences that you want to share with us, do let us know. I think, it's really interesting for us to hear different perspectives. We've heard now from someone who's actually had it and someone who is in the field, the medical field. And then, just hearing your opinions as well would be great.
Yeah. Thank you for joining us, Dr. O. And thank you to viewers. Do you call them viewers, Natasha? To our viewers for watching and joining us. And please subscribe, and comment. And your opinions, I forgot. And we look forward to hearing your opinions. Really, really, the thing that we enjoy the most is engaging with everyone and hearing people's perspectives. If you are also in the medical field and you want to share your perspective, maybe you have a different experience in the district that you're working in. If you've had, as Natasha said, if you've also contracted the virus and you want to share your experience, please let us know. And see you next time.
Awesome. Bye, guys.
Thank you so much. Thank you. Bye-bye.